the largest challenge of my nursing career has been taking care of COVID patients. The patients that we're seeing in critical care are extremely ill. Often we do everything we can for them and it's not enough. We still lose them.
When COVID units were set up, nurses at Baptist Health didn't expect to need them more than a year later. Since the introduction of COVID-19 vaccines, the number of patients in their care has gradually diminished, but it has been a long road to get here. Today, nurse Kayla Chelf reflected on that road and the unimaginable loss families had to face in such an abnormal way.
To lose that number of patients in the manner that we were losing them, which was often, traumatic, without their families, those kind of things. It's been really, really hard on the staff to see that kind of loss.
The palliative care coordinator at Baptist kept track of every person lost in their COVID unit, and from March 2020 to March 2021, they lost 119 people. And that's coming from a smaller critical care unit. They only have 18 beds. And as for the road ahead,
we've not seen a decline in acuity, but we have seen a decline in numbers, and that's encouraging.
Chelf says since the vaccines, they've seen less people, but they are younger and still getting seriously sick. After having their unit filled up for almost a year, they now have only 2 beds occupied out of those 18.